There's no place like home, and that's especially true if you've had a stay in the hospital. So how can you get home safely, but sooner? Doctorate nurse practitioner Lori Margavicius has joined us in the UH Broadcast Center to tell us about a program that works to do just that. In addition to being a certified nurse practitioner, Lori is also a department educator in University Hospital's Center for Lifelong Health Post-Acute Services. Wow, what a title. So this program is in place in actually skilled nursing facilities, right? Correct. So I thought we were talking about getting patients back home. So.
Unfortunately, a lot of people aren't ready to return home right from the hospital. A lot of folks, particularly the frail elderly, just aren't ready to make that transition yet. So they're sent to skilled nursing facilities instead, where a medical team can monitor their care as they progress through therapy, with the hopes of returning home safely.
Okay, so you're following them as they're getting better there.
Correct.
So then how does that program actually work?
So when the determination is made that a hospitalized patient needs to go to a skilled nursing facility, the hospital social worker will make a trip to the patient at the bedside and bring a list of all the skilled nursing facilities in the area where the patient wants to rehab. Now, UH uses Medicare's five-star rating system to choose specific medical facilities in the area, skilled nursing facilities, to send our team of nurse practitioners and doctors to practice, to monitor the care so we can get the patients transitioned to home safely.
Okay, are they UH facilities or not necessarily?
They're non-UH facilities, but chose specifically for the level of care that they provide. So UH only works with facilities that have a 3-star rating or above.
Okay, so the better ones, of course. So now, are there nurse practitioners in each of those facilities?
So we pair nurse practitioner and physician teams up in 2, and each pair is assigned to 2 to 3 facilities. So we're not always in the facility, but one of the medical providers is in the facility 2 to 3 days a week, and we can be there more often if we need to be.
Okay, so what happens though if a patient is in a facility, there's some kind of issue, and a nurse practitioner isn't there right away, right on premise?
So remember that we only work with the select skilled nursing facilities. So the nurses in the facilities are doing their own physical exams, and when they notice a change in the patient's condition, they call us right away. So one of our team members, either the nurse practitioner or the physician, is on call 24/7 to respond to any acute issues.
Okay, so we've talked about sort of the transition from the hospital to the facility, the nursing home. What about now from that nursing home to home?
So in this setting, the nurse practitioner actually becomes a temporary primary care provider for the patient. And then when we're ready to discharge the patient to home, the nurse practitioner writes up a discharge summary and sends it to the primary care provider in the community and transfers the medical care back to them. So there's a continuity of care there. And then we would also include our last physical exam results, a current list of medications, and the last lab results for the physician to refer back to. And then a staff member in our department would call the patient once they get home to make sure they transition smoothly, to make sure they were able to get their prescriptions filled, they have a ride to their follow-up appointment, and all the equipment that they needed was delivered.
Okay, sounds like a great program for the patients. Skilled nursing staff, nurse practitioners, and physicians. UH provides a collaborative approach to patient care from hospital to home and everywhere in between. And the most valuable players on this team, I vote for the nurse practitioners who are monitoring your every move to help you move out of skilled nursing care and into your home sweet home. My thanks to Lori for joining us today.
Learn more by calling the Center for Lifelong Health at University Hospitals at 1-844-312-LIFE. That's 5433. Or visit their website, www.uhhospitals.org/lifelonghealth. Next.